Trade unions in America need to fight for Medicare for all because healthcare is a human right. The NHS was founded in 1948 under the then Labour government led by Clement Attlee. It came about following World War II, where British people had suffered enormously. We'd seen a lot of our industrial base kind of either damaged or destroyed or converted to wartime production. The amazing thing about the Labour government at the time was that it had a radical and transformative programme that promised decent healthcare for all. The then health minister, a guy called Hiram Bevan, decided that working class people in this country had been let down and it was time actually to make the NHS happen, to ensure that healthcare was not some sort of privilege to be bartered for.
This leaflet is coming through your letterbox one day soon. Or maybe you've already had your copy. Read it carefully. It tells you what the new National Health Service is. Hospitals and specialist services, medicines, drugs and appliances, care of the teeth, care of the eyes, maternity services, home health services.
So, since 1948 and the creation of the National Health Service, it has been under constant attack by the forces of capital, by big business, by what I would describe as kind of the private insurance vampires. To them, the existence of the National Health Service is totally anathema. They hate it. They really hate it. And the reason being because there's no profit in it. There's been a number of attempts to try and privatise different sections of the NHS, and this has happened under both Conservative governments and regrettably under Labour governments. They basically want to make the NHS akin to what you have in the US, and it's horrific. And British people will not stand for that at all. When people saw how popular it was, it became clear that kind of the NHS was not something that people could get away with damaging in such an obvious way.
One claim for more money everybody supports, except the powers that be, is the nurses.
Because the NHS is a national body, it means that unions only need to negotiate with the one organisation. And what we've got in the NHS is national terms and conditions that apply to nurses, midwives, allied health professionals like physios and occupational therapists, porters, ward housekeepers, basically anybody who is not a doctor or surgeon is covered by these negotiations. One of the big differences between like our national healthcare system and what you guys have got in the US is that our unions are not having to negotiate for health insurance. You don't end up with a situation, as I saw the other day with GM, removing health insurance from its workers who were on strike. I mean, that is not a concern of the British workforce. Something so sort of like spiteful and malicious that an employer can do in the US is just not something that would be applicable in the UK. The idea of workers not being covered by the health system is, I would say to most right-thinking people in the UK, just grossly immoral. Medicare for all is not only a victory for the US Labour movement, but it's a victory for all Americans. Taking healthcare off the bargaining table means the US Labour movement can fight for better terms, better conditions, better pay. You know, this campaign is both how you grow, strengthen and maintain the US Labour movement. For decades, working class people across the UK fought and struggled, and it was through our trade union movement that we achieved the National Health Service that provides healthcare for all. I think it's about time that Americans have the same opportunities and the same rights to healthcare.